Honorable Speaker, it is usually the desire of every government to provide health care to its citizenry. And as it were, Honorable Speaker, there was need to change from what was old and of old generation, the National Hospital Insurance Fund, to what was presumed to be a better quality healthcare system, the Social Health Insurance Fund, SHIF, that is to be managed by the Social Health Authority.
The authority is called Social Health Authority. And this authority, that is the SHA. This authority was a creation of this House. It runs 3 funds: the Social Health Insurance Fund, the Emergency, Chronic and Critical Care Fund, and the Primary Health Care Fund. All the 3 funds now replace the one fund which we had, the NHIF.
To catch. What about people who are self-employed? What about the indigents? What are we able to do to them now? And that is where the problem is, because they can register. And even when they register, then you have to determine the premium they have to pay. As it is now, that is not working well.
Of the public into the Social Health Insurance Fund. It might be politically expedient and very politically correct to speak to the gallery of how things are not working, but as we speak to Kenyans on how things are not working, let us remember that Kenyans have charged us with the responsibility to make sure that things do work for them.
One of the things that I can indeed say is that the proof of the pudding is in the eating. So it is actually too early to even say, we would be cheating ourselves to say that here are the benefits. We don't know the benefit yet. If you are an excellent person at monitoring and evaluation, you cannot say within a month that we can see the benefits. So yes, we will probably see the benefits much later.
And I have decided, since Sunday I decided that I'm going to help. So for me, I'm going to go out flat to register all my constituents. But we have to involve other players. Let's not say that we have enough staff. Those CHPs, if they were trained to actually register people in this scheme, it would work.
Services. But today they are being asked to register again. And I think this is where the biggest problem is. So we would like to hear from those responsible why there was no bulk transmission of existing members under the previous insurance scheme.
Denial to access to health. I went to 2 hospitals that are mission run, 1 public referral hospital and 1 level 2 hospital. And I interacted with the patients and I gathered there is a big problem.
With the implementation of SHA and SHE, it's about the clarity of the transition. Mr. Speaker, when the government decided to move from NHIF and now to the SHA, which is the authority, and with the benefits that we are being given by the chair from SHE to the emergency to the primary care, there was no proper communication and clarity.
Just like any other program or project, there will be those teething problems when it's being implemented. And I think that is where we should focus. But there are also success stories. Honorable Speaker, I'm just from my constituency. The whole week, I was not in Parliament last week. And I did public participation. And one of the issues I was sensitizing my people on was on SHA.
Every member here, I'm sure every weekend, you are being called for some arambe, even when they know they burnt arambes. You are being asked to contribute for some sick person. It is humanitarian. You can't start telling them arambes were banned.
Put a desk in our constituencies. Let us register our people through our community health workers so that we see these numbers, so that we now get to understand, and even as ourselves, to have a tent here, outside here.
So this is basically the main problem that we have as a nation. All these registration processes have failed before. In the last parliament, we placed 6 billion each year for 3 years for purpose of registering indigents. Nothing came out of it.
What is the fate of the NHIF staff? As a result of that, they expect them to work as if they are very happy. And these are some of the things you don't get right and you fail. The third point, Honorable Speaker, the issue of the budget. the allocation has been less than a quarter of what is expected. But to make things worse, we come here and publicly announce that we have a digital system which we are going to install, which is going to cost 104 billion.
We have access to social media, we have local media, we have vernacular media. Why don't you use all this that you have access to educate Kenyans properly, to understand this, and also take on the feedback that you're receiving from Kenyans?
Government must take this thing very seriously, because even as I speak, there are many people who are not registered anywhere. I think this we need to do something on very, very urgently. And in addition to that, a bad mistake was done that there was no public participation adequate.
To take up more responsibility and more debts. So it's therefore important the executive needs to assure service providers that whatever you are owed by NHIF will still be taken over by SHA after the due diligence process is completed. Second, Honorable Speaker, yes, we might have insurance cover, but if the primary facilities do not have adequate resources, then the entire system, Honorable Speaker, is going to collapse.